Hi Angela, my name's Alyssa. I'll be your student physical therapist today, along with...
I'm Taylor. Nice to meet you, Angela.
I'm Ryan.
Hi Angela, I'm CJ.
And we'll be evaluating your neck today. So Angela, I just want to ask you a few questions. So you're coming in, your neck is bothering you, so just tell me a little bit about that. When did that start?
Probably about January, but it's gotten significantly worse as I've worked more in a doctor's office. I'm answering phones and sitting at a desk and leaning forward to look at my computer screen. Yeah. So.
And when did you start that job then?
In April.
In April.
Mm-hmm.
So would you say it just has been like progressively getting worse?
Yes.
Okay. Can you point directly to where it bothers you, where it hurts?
On the left side actually today, and back here as well. Any movement that I'm making, it's shooting up into here. Not really. Same thing, turning on this side, pain on that side.
Okay. And is that pretty consistent? It's always on that side, or kind of changes?
It kind of changes depending on what goes on.
So today's on the left side.
Mm-hmm.
Okay. So is there anything that you can do that makes it worse, or that you can make it feel better?
Laying back on my back, because it kind of releases any sort of tension that I have of keeping it upright. Kind of releases it a little bit, and making it worse is kind of any movement turning that's not just completely straight.
Okay. Any particular way turning?
To the right hurts more.
Turning to the right?
Yeah.
And how would you describe that feeling? How does that pain feel?
The pain's constant in the back right now, like probably like a dull pain around, I'd say like a 2 out of 10. If I turn, it probably increases it. Last night I was probably at like a 7 or 8, to the point that I had to take like a leave or an Excedrin because I had a headache that I couldn't like do anything with.
And you felt it right in that
area, yeah, on the left side.
Okay, so it's been consistent right in that area?
As of yesterday, yeah. About a week ago, it was on the right side solely, but I had an accident with the trampoline.
What did you have with the trampoline?
When I was doing a flip, I heard like a cracking noise, and then when I stood up, I like saw like stars. Felt like I was gonna pass out, and then I had to like just like lay down on my back or on my stomach actually, and just kind of have like somebody pushing against different spots because I could like feel it like spazzing.
So in that same spot that you're talking about
Yeah.
that hurts,
Mm-hmm.
It was like you felt like the crack came directly
from there.
Okay.
I could like pinpoint where it was, and I could like feel it all along my shoulder blade on my back, and then it started to like radiate down my arm a little bit, and it was pretty consistent. I could like last night I could pinch like right here and it would hurt, but yeah, mainly.
Do you have those feelings down your arm right now?
No,
No, nothing.
not really.
Is there anything that you could do that could?
Yeah, if
kind of
I turn to this side and hold it there, it'll just start to radiate down to my fingertips.
When you turn to the right.
Turning to the right, yeah, if I get to a certain point.
Okay. And then you feel it going like from that spot in the
Yeah.
left all the way down to your arm?
Yeah.
Okay, gotcha. Okay, so you kind of mentioned it on a scale of 0 to 10, 10 being the worst. How would you rate the?
Right now it's probably like a 2. It's just dull. It's I can feel it. If I start to move, then it starts to increase probably about to a 4.
Okay. And at its worst, what would you say it is?
Last night it was probably like an 8.
An 8.
Mm-hmm.
Okay. Do you find that it hurts more at any particular time of the day, when you first wake up, when you're going?
Today when I woke up, actually I felt the best. Last night was the worst because it was just I couldn't even find a comfortable spot to like lay. As the day went on, I put heat on it this morning. I was kind of just sitting at work with heat on it, so it kind of like eased up a little bit. And then as I was coming home, probably around like 7, I could feel it again, especially driving, like turning like to do anything, driving in my car. I felt like it was just like tensing up again, to the point where it was just very painful. But there was like there's certain stretches I can kind of do that are like, it increases the pain for a moment, but then it kind of releases it.
What stretches are those?
Like just doing like chin tucks, or kind of just leaning into it almost, or just kind of like stretching my back out.
How about putting your neck
No.
back? No what?
No, it's very painful.
You wouldn't?
No, I don't
wouldn't
even want to do it.
Okay. So would you say since your neck pain, there's some things that you're avoiding doing,
Yeah.
some things you can't do because of it?
Yeah, like even like from right there, like that's it. Going back, that's as far as it's gonna go before I feel like it's gonna just like increase pain.
Would you say that motion hurts more than turning over your right shoulder, or what would you?
It kind of
Say
triggers in the
what's-
same spot. This one definitely comes sooner. Like even just that, like to right here, I can feel it right away. Here, I can at least kind of like know when it's gonna happen.
Okay, gotcha.
So it's just kind of like excruciating, like right there, like that's it.
So those kind of motions you just completely
Yeah.
avoid doing because of that?
Yeah.
Okay, gotcha. And do you ever get like headaches or anything from this?
Yeah, last
Or-
night I had a migraine. I couldn't do anything. I had to just like I said, I took Excedrin, and I just had to lay there. I had to turn off all the lights and just like I had to just lay flat.
Okay, where did you feel the headaches?
Yesterday, I would say it was right in the middle actually, and then on the right hand side it was. But this morning when I woke up, it was just right in the middle of my two eyes.
In the middle of your eyes.
And I could like pinpoint it, like I could press into it and like kind of feel like a release.
When you pressed right into
Mhm.
that spot? Okay, do you ever press in the back of your neck? Into,
Yeah, and I can feel it.
you
So
can
like
feel it
yes,
makes it
yeah, it was
worse.
like yeah, it was making it worse.
Okay. Do you ever, do you always get it on the right side, or is it ever on your left side?
Mainly it's
or
on my right side.
on the right side. It's never on both sides?
Not typically, no. That's only when I have like a headache, but a migraine like is different. I can like pinpoint exactly where it is.
Okay. Do you know when they're coming on?
Sometimes,
Typically?
like yesterday, obviously when I did the trampoline accident, I knew I was gonna get one.
You knew you were gonna get one just from how?
Yeah, how it started to feel.
Okay.
My neck started to hurt, and then I could tell like it was coming on.
Okay, and then you said you laid down, you took some
Excedrin.
Excedrin. Okay. Are you
Drank water.
Oh, drinking water, okay. Is there any other medications you're taking other than the Excedrin?
Not
Okay.
for this morning. I took a leave when I got home
You took a leave,
Mhm.
okay.
before I went to work.
Gotcha. And have you ever had any neck pain prior to this?
Not really. Just like back in January, like I said, it started when I was working a lot more than going to school.
Gotcha.
Like
And-
even moving that right there is painful. Like moving my left arm up to here is stretching in here.
So what other motions do you do that you feel it in your back?
Just like that, I guess. I can feel it. This side doesn't really bother it.
So just moving your left arm.
Yeah, I would say so.
Do you feel
Like even like here, like I can feel it pulling.
Okay. Do you feel like that hurts more than bringing your
No,
neck back?
no.
Still bringing your neck back hurts the most?
Mm-hmm.
Okay. Is there any other motions you can think of that bothers?
Just coming forward. Like I can feel it stretching it a lot.
So going forward, you feel stretching, but you feel it like.
This is very painful going.
How can you describe that pain?
That pain is like a sharp pain. I could feel it right here, and then it can it radiates up,
It goes up.
up until like the peak of my, right where my head starts. I
The
guess
base of
the
your
base
skull?
of my neck. Yeah. Base of yes,
Makes you
top of my neck.
Okay, no worries. All right, and so what do you do for work?
My full-time job is a patient care coordinator receptionist at a doctor's office. Part-time job is physical therapy aide on Saturdays, and some Saturdays I'm also assistant manager at a pizzeria, which includes answering the phones or running the salad department.
Okay, so typically your full-time job, you're sitting, you're at a
At a
computer?
computer desk, holding the phone in this hand and typing with this one.
Do you ever-
Sometimes I find myself like this, but today I couldn't. Like even just going like that, like I couldn't even manage. Like I could bring this up to it, but then it starts to like hurt. But I can't really bring my ear to my shoulder.
Okay,
Like turning my head, that's probably as far as I can go. So the phone's not gonna be able to sit in there.
okay. And still bending backwards? It hurts the
Definitely, yep.
most? Okay. And how about the other two jobs that you have? What are your typical?
Well, physical therapy aide, you kind of just run through the exercises with the patients. It's pretty easy. And then
Well, how are you, like, are you standing
well,
a lot?
I haven't
Are you
done
sitting
that.
a lot?
Yeah, standing a lot, but I
Okay.
haven't done that in probably a month now because they're off for the summer
Okay. And
on
then how about
Saturdays.
the restaurant?
Standing the entire time,
Okay. Out of all
But
three? Okay.
standing like leaning forward because everything's shorter than I am.
Okay, gotcha. So out of all three of those, when do you find that you feel the neck pain the most?
Sitting at my desk
So your full-time
at work.
job?
Yeah.
Okay, and at work, is there anything that you do that makes it feel better?
Well, I found that I have a back support now, so I tend to sit up straighter at work because I kind of like can push into the seat more rather than like the seat that it was before. It was too short for me because I don't accommodate tall people, and so I had
Okay.
to manage and get a back support thing, and now I sit there much better. So it's definitely improved, but
Okay.
still some improvement to be made.
Alright, so what I'd like to do next is just do some palpation or touching to figure out if areas are kind of tender so that we can figure out what's going on. Is that okay?
Mm-hmm.
Okay, so I'm going to start back here. Okay, so what I would like to do next is just some range of motion stuff. Okay, so what I want you to do, I want you to extend your neck back as much as you can. I know we said it was painful earlier.
Like right there.
Painful? Where is it painful?
I can feel it like right in here.
Back of the neck, around the spine?
Mm-hmm.
Okay. We're not going to do overpressure, but what I want you to do, you're just going to push your head into my hand. There you go.
There's a little bit of pain on that, but it's more of like I can feel it starting back here, and then it kind of like travels up to like that spot. Like it's almost
Okay.
like a radiating pain when I go to push forward.
Okay, so between the shoulder blades on the left side, coming up to the same location as it was before.
Mm-hmm.
Okay. Then what I want to do next, go ahead, flex your neck as forward as much as you can.
Probably like right there, and it's painful mainly right there. There's like a little bit, but not nearly as much as when I was going back.
Okay, I'm going to bring it into a little bit of overpressure. Still painful?
Yeah, so it's kind of radiating up into here,
Okay.
but again, not as painful as going backwards.
So I'm getting a bit of a muscular feel there as well. Okay, so what I want you to do now, you can bring your head back up. Rotate as far as you can to the right.
To the right.
Mm-hmm. That feel okay?
Mm-hmm.
Okay, I'm just gonna add a little bit of overpressure. Any pain?
Right back in here.
In the back, kind of
Mhm.
lower back?
No, like right along my shoulder blade.
Okay,
Right there.
similar places before.
Yeah,
Okay. Still any pain?
not as bad.
Okay. So you can get a little bit further. Now I want you to rotate to the left as much as possible. Any pain there?
Yeah, that same spot, but not as bad as the other side.
Alright, I'm just gonna do a little bit more.
That kind of shoots up into like the base of, like up in here.
Okay, still on the left side though?
Mm-hmm.
Okay, and then I want you to push back towards center. Okay, actually I want you to do that on the right side as well. I almost forgot. There we go. Come back. Good. Okay. Now what I want you to do is bring your right ear to your right shoulder. Any pain with that?
Yeah, that same spot on the left side.
Still right here.
Mm-hmm.
Okay. Just gonna add a little bit of overpressure. Still the same pain.
Mm-hmm.
Okay, now I want you to push back up into my hand. Good. Let's go to the other side for me. Any pain there?
Just a little bit of stretching like throughout here,
Okay.
and as I kind of raise my arm up like a little bit more.
Okay. And then a little bit of overpressure. Still pain?
A little bit, but not as that bad.
Okay. And then I want you to come back towards me. Good. Okay. What I want to do now is just a little bit of your upper thoracic, since you're noting some issues there.
Mm-hmm.
Go ahead and cross your arms for me. There we go. I want you to kind of flex forward here for me. Okay, that's good. And I want you to extend back for me, same thing. Just gonna bring your head a little back. Any pain with that? Okay, now try to push forward. Good. Come back forward again and try to push back up. Good. What we're gonna do next is just rotate towards the right. Any pain there? Okay, just gonna bring it a little bit further. Okay, and I want you to kind of push back for me. Good. Let's do the same thing to the left. Lower pressure. Push back. Any pain with any of these?
No.
Good. Okay. I did forget a couple neck ones, so I want to go through those right now. I want you just to come forward for me. Okay. And then I want you to push back. Any pain with that?
No.
Okay. And then I just want you to do, it's a chin, called a chin tuck. You're just gonna bring your neck kind of back there, chin towards
That's
your
as
neck.
far as I can go without it creating pain, kind of like right here, and then kind of up in here as well. But it's
Okay.
mainly like at the base right here.
And then just do the opposite, kind of tip your chin forward for me.
The same thing.
Okay. Same pain?
Yeah.
Okay.
It's almost like I'm like protecting it too. Like I can anticipate the pain.
Okay. Gotcha. All right. So what I want you to do, we're gonna start here. I want you to kind of bring. Have you close your eyes, and what I'm going to do is just some light touches on both sides. I want you to tell me if it feels the same. Okay? Go ahead and close your eyes. Good. Okay, so I'm going to start back here. This one, just where I'm pressing may bother you, but I'm looking for something slightly different. Any pain?
Just where you're pressing.
Okay, but no clunk there, so it's not really considered a positive. Okay, what I want to do is come up here. Just going to rotate your head, just let it relax. Okay. Good. So that was fine. It's all normal there. So what I would like to do next, I'm just going to come in and I'm going to push your head down a little bit. Okay, this may cause some of your symptoms again. That's actually what I'm looking for. I'm trying to recreate it. Okay?
Mhm.
Is this hurt at all?
Not as bad.
Not really?
Mhm.
Okay. I'm going to bring it over here. Just here in range. Okay. Pushing down here.
It's a little bit
Where is it? Is it staying in one spot or is it
Mhm.
going down?
that back part of my neck.
Okay. I'm just going to give a little bit of distraction here. Does that make the symptoms go away?
Yeah, it kind of like feels like it's like releasing it.
Okay. Good. I'm going to bring it over here.
It's probably as far as I can go.
Okay. I'm just going to give a little bit of
Yeah.
push down.
That one
Pain?
hurts. Yeah.
Okay. I'm going to get a little bit of a lift. Make that go away.
Mhm.
Okay. I'm going to bring it back here.
Like that's it.
Okay.
I'm gonna go.
Side bend just a little bit if we can.
Okay.
Is that painful?
Mhm.
Okay. Just going to push down gently. Does that feel okay?
Mhm. Just that same pain.
Okay. I'm just going to again lift.
Yeah, it releases it.
Okay. I come over here.
It's like that same spot.
Okay. Is anything traveling down your arm?
Like a little bit. I can feel it in my palm a little bit.
Okay. I'm going to give a lift. Does
And
that
it
tingling
releases.
go away?
Yeah.
Okay. Good. So that probably means we have a little bit of your facets are probably closing a little bit on this side, which is pinching a nerve. The nerve goes down the arm. So that's what's kind of going on there. Okay. What I want to do is just some arm neural testing to confirm a little bit. So we can put this over here. I'm going to bring your arm up. Knee here. Okay. And I just want you to let me know when you start to feel some tension in your arm.
Right there.
Right there.
Yeah, start to get like tinglings all into my fingers.
Okay. I'm going to do the same thing on this side. Let's just break the arm up for me. I'm going to bring the arm back. Let me know if you start to feel anything.
Yeah, into my thumb.
Into your thumb?
Mhm.
Okay. Sounds good. All right.
Is basically what we noticed in kind of the motions you've been doing is that leaning back, the extending your head back is causing you the most pain. It's the most limited we noticed in your range of motion. So with that being said, I'm going to put my hands on you if that's okay. I'm going to apply different stabilization at various points from your neck into your shoulder as well as your ribs. That way perhaps we can kind of see if maybe there's something contributing to your pain that is not just your neck. So what I need you to do is you'll tell me if something either helps decrease the pain, or if we notice that it helps increase your range of motion. So if you could for me, just show me first how you can extend your head back. Let's see where you can go.
About there.
Okay, about to there. We'll take it. All right, come back to center. So first what I'm going to do, I'm going to start at your neck. And I'm just going to apply a little bit of a lift. So first, okay, so go ahead, lift up. Now go ahead and come back.
To about like right.
Okay, so that was a little bit better. Even a little bit further you're going.
I
Okay,
feel like right there.
right there. So, and what's the pain? You can come back. What's the pain like?
It's not as sharp as it is, and I'm not like as like nervous to go back.
Okay, so because that works, before I do something else, I just want to see something. So, what I want you to do is think about growing super tall, right? Some people like imagining a string coming out of their head. If that doesn't work for you, I want you to think about growing super tall and think of like a candy cane shape and start to create that candy cane shape with your neck. See if that helps. Okay. Alright, come back.
Oh, like right there.
Okay, that looks pretty good. That's good to know. We're gonna try one more thing. So, I'm just gonna feel here. For anything potentially translating, you let me know if I'm pulling your hair.
No, it's okay.
And remember, if it doesn't help, just be honest.
Mm-hmm.
Alright, so this guy a little. Alright, go ahead, let's try it again. Come back.
No.
Yeah, no, I don't feel like that's helping either. I'll come back. Okay. So this next one, I'm gonna come right underneath your armpits. Yep, just relax. I know, are you a little ticklish? Sorry about that. Okay, so I'm gonna add the lift, and then you're gonna do the same thing with your neck. So coming in, now come back.
No, it's still right. Like,
Still nothing. Okay, I feel ya. So yeah, just relax. Now you tell me if you feel any tenderness.
okay.
Okay, there we go. So let's do a little lift here. All right, try that.
No, it's still the same.
Okay, come back. So I'm gonna try your shoulder blade. So first I'm just gonna add a nice little lift. Go ahead, up and back.
It's there, but it's not as painful because it almost feels like it's not like where the pain is. It doesn't feel as like sharp. Like it's almost like I can feel like I can turn a little bit, so I'm not going straight back necessarily.
Like it helped to feel a little supported.
Yeah.
Okay. So now what I want you to do is I want you to think of as if this part of your skin was being pulled up to the ceiling, right? So it's not this, but you're
Okay.
thinking about kind of like lifting it up and back and then try to extend your head back.
No, that one doesn't help as much as the very first one.
Okay. So let's try one more thing. Okay, go ahead.
No, it's still right there.
All right. Some very good findings here. And how's your pain right now?
It's okay.
Okay, yeah,
It's
keep me
manageable.
posted, please. Manageable. I like that word. All right, go ahead, come back.
No, it's still right there.
Sorry, you're like, and no.
Well, I can tell right away.
Totally. All right, try that.
No, it's still that spot right in here.
Okay, awesome. So that helps a lot. Can you swing your feet around to face this way? So I'm just first what I want you to do for me is turn your head to the right. Okay, come back to center, and then turn your head to the left. Alright, come back to center. So what I want you to try to do, so this is an over-exaggerated version, this. I want you to kind of go the full way, chin tuck, and then come out of it just a little bit. Right? So you're keeping everything
Right.
strong.
I mean, going into it, if it like creates.
It's too
pain.
much? Okay,
Yeah.
so then
Like you can do it, but it's not.
go right to before you feel the pain. Don't go to the pain,
Like
go
right there.
right there. Okay, so no pain right here.
Mm-mm.
Okay, so this is fine. So I want you to hold this, try to hold this position,
Mhm.
right? But then as fluidly as you can, try to turn to the right. Okay, come back to center. And then turn to the left. Okay, come back to center.
That's about it.
That's about it. It's okay, yes. Please don't push into pain. So, same thing here. I want you to tell me if either anything that I'm going to do is decreasing pain or we'll see if it increases your range of motion.
Should I try and go back to that point or just?
If
go
you
like
can
that
maintain
till-
it right now, I want you just to be normal. Don't
Okay.
think too hard. You just do what's normal.
Okay.
All right, turn to the right. That makes it worse or better?
No, it's probably as far as I can go.
Do you feel like you got farther with me lifting or without me lifting?
Without.
Without me lifting.
Mhm.
Okay, so let me try one more thing. Come back to center. Okay, try that. Turn to the right. Better?
Mm-hmm.
Interesting. Okay, so we're still going to turn to the right, but this time, okay, turn to the right. Better?
Mm-hmm.
Yeah, interesting. Okay. I'll stop using the word interesting. All right, turn to the right. Worse.
I mean, I feel the pain more. Like it feels like it's like pulling here
Okay.
a little bit.
So now let's go to the left. So we saw your motion to the left. So
It's just like
I'll stay on this side.
there.
Okay, back to center. Turn to the left. Better or worse?
I can just feel it like lower in my back rather than like higher up.
So not better.
Yeah.
Okay. Turn to the left. Better.
Mm-hmm.
Okay. Turn to the left. Better or worse?
I'd say about the same as like without it.
Okay. Ready? Last time. Turn to the left.
It's probably worse.
Worse. Okay. Good things to know. We'll move on.
Okay, so now I'm just going to kind of tension a little bit through your arm. So you just let me know when it bothers you. So I'm just going to take your arm. You okay?
Mm-hmm.
All right. Let me know when it hurts.
Like right there.
Okay, turn your head to the right. Can you turn it any further? Just a little bit.
Right there. Yeah.
Okay, now come back to neutral. I'm gonna put it back on. Does it hurt?
Like right there.
Okay, turn over your left. Can you come any further?
A little bit.
Okay. I'm gonna do the same thing on the other side. Again, just let me know.
Right there.
Okay, look over your right shoulder. Look over it more.
About there.
Okay, go back to neutral. You feel okay?
Mm-hmm.
Again, let me know.
Right there.
Okay, look over your left. Can you go any further?
Right there.
Okay.
I'm gonna assess the way your spine is moving. We're suspecting that potentially maybe there's some maybe some stiffness going on. So I'm gonna come in here.
Okay.
Yep. Trying not to squish anything. I'll be gentle. So if anything starts to hurt, stop me. Just tell me to stop.
Okay.
Okay. I'm just assessing here for everything. What should be happening is when I lean your head back, these spinous processes should be closing. Okay, those aren't too bad. Here I'm noting a lot of stiffness, kind of right up here in your lower cervical spine. These guys don't want to close very much. Okay, so really what could you do for me? Bring your hands behind your head just like this. Okay, really nice. So I'm going to come in here. Alright, let's come back. Okay, let's do a little overpressure. Yeah, noting a capsular end feel there. So these, yeah, so basically these bones are not wanting to close very well. Okay. All right, now can you cross your arms across your chest like this for me? Okay. You okay there?
Mm-hmm.
Okay, let's do some overpressure. Come back there. Can you do one more time here for me? I want to explore these two one more time. Okay, coming back. Okay. All right, I think we have some good findings there. We'll move forward.
All right, Angela, so since you are unable to hold the chin tuck correction, what we're gonna do is we're gonna test the strength of your deep cervical flexors. So we have the blood pressure cuff behind your neck, and I'm gonna pump the blood pressure cuff to 20 milligrams of mercury. Okay, so it's at 20. You're going to move your head back, or you bring your neck back so that you the line reaches 22, which is the first mark. So you can move your neck back. Okay, hold that for 10 seconds if you can. Let me know if you're getting any fatigue. All right, looks. Okay.
I got tired there. I had to let
Okay.
go.
I was counting that you were able to hold it for about 5 seconds. So what we're gonna do is try to have you hold that again
Mm-hmm.
for 5 seconds again. Okay, we're gonna keep going at this. The goal is for you to hold it at 22 for 10 seconds 10 times. So we're gonna address this later when it's time to put your exercises together. Okay?
Okay.
All right.
So now, because that cue worked for you, remember when I gave you kind of that candy cane imagery? So what I want you to do is I want you to see if you can take that same imagery we worked with before, hold that motion, count to 10, and then try to bring it back.
Okay.
So ideally what's going to happen is you'll do this for 10 seconds, 10 times. Up to 2 minutes is really the goal. But so let's try it a couple times together. I want to see how you're able to hold it throughout the range. So go ahead, think of your candy cane imagery. So you're lifting, and then go ahead and come back. And hold it, and just let me know how you're feeling. If you start to feel tired, come out of it.
Kind of like right there.
Yeah, what does it feel like?
It feels okay. Like it doesn't feel like it's like it starts to hurt a little bit in the back, but it's not like where it's here.
Do you think that you would do you think those muscles, like after you did that like 5 times, that they would start to feel tired?
Mm-hmm.
Okay, so then this is gonna be our appropriate dosing for this. We'll keep it at this level. So when we move on to the next phase, we'll do it for 10 seconds, 10 times, up to 2 minutes. Cool?
Mm-hmm.
Okay, great.
Okay, Angela, since you had a shooting pain from your neck down to your arm, we think that your nerve is being pinched. And also earlier, Ryan did the distraction test. He created some space in your neck, and that made your symptoms feel better. So what we're gonna do now is cervical traction. Again, it's creating space and hopefully relieve the pressure on that nerve. Does that sound okay?
Mm-hmm.
All right.
Okay, Angela, so since we found the middle of your back was kind of really tight, what we want to do is loosen them up by essentially just cracking your back. So before that, I'm just going to do a few tests. Are you okay with us cracking your back? You feel okay with that? Okay, first one, just let me know if you feel anything in your back. It's okay? Okay. Anything? Okay. 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 Now just bend your knees for me, and then come a little bit closer. Okay. All right. So just what I want you to do is roll towards me first. Okay. Just gonna look for those segments back here that we found before that were a little bit tight. Okay, so what I want you to do is just roll onto your back again. Okay, and just kind of bridge up. Perfect, you feel okay? Okay, cross your arms nice and tight. Give yourself a big, big hug. Actually, I want you wrap your arms around, oh, I'm so sorry, around your shoulders. You feel okay? Okay, and then just come up a little bit. Bring your head up. Okay, you can relax. All right, so first what we're gonna do, does my hand feel okay where it is? Okay, so first what we're gonna do, we're just gonna take a deep breath in and out. We're just gonna hang here. Feel okay? Okay, take another deep breath in. Okay, one more. I got one.
So, after everything that we've done today, let's see if we've made any improvements. So what I want you to do is, keeping in mind everything that we talked about today, go ahead and extend your head. Go ahead and try to look back for me. Lift up and back. Alright, come back to center. What do you think?
It was a lot easier.
It looked smooth. So, alright, so we're pleased. So we'll send you home with some things to do at home to reinforce what we did today, and we'll continue to work on that stuff and hopefully continue to remove some of this pain. Cool? Okay, great.